Michelangelo was once asked how he created the David. He said, "I saw the angel in the marble and I carved until I set him free." He didn't force anything onto the stone, he simply revealed what was already there. Every patient who sits across from me is searching for something, but it's usually not what people assume. They're not trying to become someone else. They're trying to look exactly like themselves again. What they're really asking is, do you understand what I see when I look in the mirror? And can you help me address it without changing who I am? That question matters deeply to me because answering it takes both science and judgment, and that's where the art comes in. I've been doing this for a long time, over 28 years in practice. I trained for 8 years in surgery, including 3 years focused entirely on plastic surgery at Northwestern, one of the most demanding programs in the country. But training is just the beginning. Rice taught me how to think. Baylor taught me about medicine. And Alpha Omega Alpha recognized excellence. But more importantly, it reinforced something I believe deeply. Excellent without purpose doesn't mean much. What took me years to really understand is this: credentials tell you what's possible. Formal education matters, but experience is really what teaches judgment. Judgment is ultimately what serves the individual patient. Every person who comes to see me brings something unique. It doesn't matter if we're talking about the face, the breast, the body. No two people start from the same place. Your proportions, your bone structure, the way you move through the world, these aren't details to work around. They're the starting point. When I evaluate someone, I'm not looking at isolated parts. I'm looking at how everything works together, how one change affects the whole, because balance matters. That's what fascinates me about plastic surgery. The human body is already a masterpiece of proportion and form. And truly understanding that, its architecture, is what allows me to enhance without disrupting what's naturally there. Whether I'm working on the face, the breast, or the body, the principle is the same. I approach it the way that a sculptor would, with intention, restraint, and respect for the natural form. This is why I spend so much time in consultation, why I look at you from every angle, why I take my own photographs, and why I slow the process down. Because the difference between a good result and an exceptional one comes from really understanding you. The great painters understood something important. Beauty isn't uniform. It is character, individuality, and truth. No two faces are the same, like no two portraits are identical. And the best artists knew they couldn't just copy features. They had to truly see the person in front of them. That's how I work. Before any plan is made, before a surgery is even discussed, I listen. I want to understand how you see yourself, what matters to you, what you want to protect, and what you'd like to refine. My role isn't to impose some standard of beauty, it's to respect who you are and help you feel more fully aligned with who you're becoming. This is where every procedure really begins, with a conversation. Not just what you want to change, but why it matters to you. Years of surgical training and thousands of hours of studying anatomy, a lifetime focus on proportion, balance, and harmony. The artistry helps me understand you. The science allows me to care for you with safety and precision. I can't promise perfection. Perfection isn't really real. And anyone who promises it isn't really being honest with you. What I can promise is this: careful precision, safety, judgment, and a result that feels natural and genuinely yours. When someone sits across from me, I don't see a procedure, I see potential. I see the confidence that they're looking for that aligns between how they feel inside and how they see themselves in the mirror. When you're ready to look and feel like the truest version of yourself, I'm here.